Shelley Weber Tompkins, a licensed acupuncturist and certified functional medicine practitioner. And today I wanted to talk about endometriosis and the effects it has on reproduction and holistic measures that can be taken to help. Endometriosis is a condition that affects millions of women worldwide, and the effects can be really very painful, and a lot of women suffer from it and they don't realize how much it can also impact conception. Understanding endometriosis can really help in knowing what types of steps to be taken, but first uncovering whether you have it or not, because most of the times people don't know what test they should even have done, and you really do need to talk to your doctor about steps to take, because if you do have some of the symptoms, and the symptoms are important to know, this whole section is about painful periods, but knowing that it's the severity of the pain and that you can also have abdominal pain, not just in the lower abdomen where you would expect with having a period pain, but it can actually be there all the time. This low level type of pain that happens, and then it's made worse around times when more blood flow is getting to the reproductive organs, like at ovulation, and also with your periods. But you may experience it all the time. And then fatigue is usually another common symptom. Gastrointestinal issues can also be part of it. Could be diarrhea or constipation or just feelings of discomfort that are going on in your gut. But it also can affect sleep and, like I already said, the fatigue that sets in. But it's just a really uncomfortable circumstance that may happen all month long, every month. What endometriosis is, the belief anyway, is the lining of your endometrium, your actual what's building up in your uterus for either your period to slough or you to have a baby be able to implant into. But that tissue is somehow going retrograde. This is one theory, that it's going up back through the fallopian tubes instead of out through the cervix and into, for your period. But it actually goes back up through and can migrate into different areas of the abdomen. And so it can connect to, your intestines. It can connect to your uterus, to the outside of it, to your ovaries, your fallopian tubes, and it can migrate to other places too. But those are some of the key areas that it normally is going into. And anywhere it migrates and attaches to that is close to nerve tissue especially can cause more pain every time that inflammatory aspect takes place. When you are having a period or when you are ovulating, it is made worse. And it can be in areas that also can cause pain when you're trying to have relations with your partner. It really can be a pretty bad situation for people that have to endure that month in and month out. And especially when you're trying to conceive, because you need answers to why that's not happening. And you may have a lower grade type of endometriosis. It may not be a stage 4, which is it's throughout the abdominal cavity. There's lots of scar tissue that exists there. And it's a lot tougher with that type of inflammation for conception. And so steps have to be taken when it's that bad, usually with medication, but you have to figure out that you have it first. Endometriosis can start with your very first period and still go all the way up to menopause. Since the symptoms of endometriosis can also be similar to others that cause pain, even having IBS or celiac, any of those conditions that already cause a lot of discomfort in the abdominal cavity, you may have to rule those out and make sure that it's not that versus being endometriosis, because they can both cause pain in the intestinal area. When you talk to your doctor, they should want to get a full assessment of what's going on with you. So a good thorough medical of your history and your symptoms. Your doctor will typically want to do a pelvic exam. They may want to do an ultrasound or MRI. The other type of test they might do, it's a little bit more invasive, is actually doing a laparoscopy where they take a scope through the abdominal. They make little incisions in the abdomen, teeny tiny ones, and they scope through and look for it that way. We know where different adhesions could be situated. Holistic medicine is a really good means of treatment for helping the pain that can come from endometriosis and the inflammation that's there, and those things that can impact whether you get pregnant or not. So acupuncture treatment is really good for that, as well as herbal medicine. Herbs have been used for thousands of years to help conditions where pain is a common factor, as well as blood circulation or flow that's impacted. And so I highly recommend getting herbal medicine and acupuncture for treatment when you're trying to get pregnant. Other means, though, I've talked about before, are stress reduction. That may seem like it's a small thing, but since it's really helping your reproductive system overall, getting you more into feed and breed mode, it can be very helpful here too. And so the same things I've talked about before with humming, singing, hard gargling, breathing exercises, guided meditation, all those are still really good in these situations too. Conventional treatments are typically going to be about pain relief and anti-inflammatory with medications that they might use. Or if it's really bad, very prolific endometriosis throughout the abdominal cavity, they may go in using a laparoscopy, like I discussed before, and try and cut away any of those lesions to make them the least amount possible there, especially with scar tissue, so that things can move better. When I say move better, I mean the fallopian tubes and everything that need to have good movement. Lifestyle and diet are another area that are really critical for trying to lessen inflammation and help with someone who's trying to conceive. And so besides acupuncture and herbal medicine that I already discussed, and also the stress reduction, is also making sure that your diet is anti-inflammatory. And Google's a wonderful search tool when you're trying to find out what are anti-inflammatory diets. And I usually like going with something that's more of a Mediterranean type of diet, but one that's like anti-inflammatory based. That can be a really good one. If you know you're going to have a hard time trying to follow a specific diet plan, I would just suggest that you're trying to do organic foods, produce, and fruits, and then also making sure that you're getting plenty of water in, that you're avoiding all the things in your diet right now that you know are not good for you. It's alcohol reduction, any medications that are not necessary for you can also be a good thing to avoid. Obviously, there's some medications that you need to be on. I'm not telling you to get off of those, but just anything that's excessive that you find you're taking every month, if you can reduce those, that would be helpful. And then making sure that you're getting in organic. I think I already mentioned organic. I can't say that enough because the pesticides are really a problem these days. And even the blow off from other fields that are sprayed can blow onto ones that are organic, but you're going to get much less than you would from one that's a non-organic source. You also want to avoid processed sugars and flours. And so when I say flour, like if you can avoid wheat, a lot of times people have done testing, but there's so much sprayed on there when I talked about pesticides before. So I really do try to avoid wheat products. They spray it, both on the fields and when they dry it. And so it's very full of that unless you get it from another country. US is pretty heavy sprayer of glyphosate, the Roundup. The other thing is getting regular exercise, which can be hard when you have endometriosis because the fatigue, but trying to even do a 20-minute walk on a daily basis or at least several times during the week can be helpful if you're trying to get your lymph moving better. Even getting a rebounder, they're little small trampolines that don't take up much space. You can actually put them against the wall upright if you're, when you're not using it, but that can also help get lymph moving better and help your system work and function better, especially when you're following a good dietary plan and doing things that reduce some of the inflammation. And supplementation-wise, there are anti-inflammatories that are better for you than taking an NSAID, Tylenol or Advil or any of those kinds of medications. There's other things you can take that might be more beneficial for your system and reducing inflammation and helping endometriosis and you getting pregnant than some of the medications out there right now for pain. If you suspect that you might have endometriosis, there's some steps you should consider taking. First, start tracking your menstruation and what pain comes with it, where it's starting, how long it occurs. Make an appointment with your healthcare provider to get a thorough evaluation and exam. And you may want to discuss some of the diagnostic tools to see if you have endometriosis. Asking about an ultrasound or MRI just to see if it exists there, what's happening. Depending on the findings, if it's more severe, then looking at some of the conventional methods they may have for removing some of it, like I talked about with laparoscopy, would be a good option. And then otherwise doing things that I discussed with our holistic medicine, with trying to help get the inflammation lowered and help your body function better, help your GI tract. Anywhere where there's scar tissue, there's other things that can be done in addition to conventional medicine, but you're wanting to make sure you're getting on track with doing as much as you can if you know you have it. And when I say as much as you can, I'm talking about the dietary aspects too and the lifestyle changes, because that's going to help no matter what when you're trying to conceive. Endometriosis can be a very challenging problem to have, and if you have it, I definitely feel for you. I've treated many patients who have it, and I suggest a support group, making sure you're working with someone who can help you. This is something that you don't need to silently deal with. Make sure that you're getting help for this. And when you're trying to conceive, you may have already been dealing this quite a while now. And so definitely reach out to a caregiver and make sure that you're doing what tests you need to and making those changes. I appreciate you following along with me. I'll be talking about some other conditions that also can cause pain and interrupt conception, so stay tuned.